Hello and welcome to the new episode of MedTech Talk, where we discuss how AI and healthcare intersect. I am Utkarsha Somani, a dietitian by profession with a degree of PG Diploma in Dietetics, and I am now a part of AxonCare Network. I'll be your host for today. So let's welcome the founder of Axonic Health and the brains behind AxonCare Network, Dr. Abhay Chopada. Hello and welcome, sir.
Hi, Utkarsha. Thank
Hi.
you for inviting
Hi.
me on your show.
Your pleasure, sir. So, today we are going to talk about the role of technology in nutrition and health management. So, my very first question to you is importance of consulting a dietitian. What you feel about that? Why it is important to consult a dietitian?
You asked me a very fundamental question, Utkarsha. So, diet is gradually being recognized as the mainstay of human health. We previously used to treat diet as just a secondary thought, and we used to focus merely on trying to correct the disease or the symptoms per se. Over the last 10 years, there has been increasing understanding about what we call as the human microbiome. And this human microbiome is the entire universe of microbes and bacteria which are inside us, almost 10 raised to 16 of them. And these are manipulated through our diet. And these are actually the driver of your well being. Forget about illness, but how you feel. What do you look like? What diseases you're going to get? Are you in pain? Not in pain? To a huge extent, this is modulated by your gut flora. So, with the understanding about the gut flora, we've started realizing that gut flora has a role in two different areas. One is what we call as normal healthy life. How do we ensure that that itself is good? And how do we ensure that diet plays a crucial role in maintaining the gut flora? To explain this, let me explain it to you. We see a lot of diseases which we previously used to say is down to processed food, right? But we didn't understand how processed food really caused diseases or caused illness in the long run. We only knew that processed food causes a lot of obesity. But then as studies went on, people realized that these processed foods actually affect the microflora or the microbiome. And the microbiome decides how much lipids are absorbed and how much lipids are actually let go. Your metabolic rate is decided by the microbiome. So effectively, diet is now the mainstay of even wellness. Now let me shift to illness. Previously, we used to again, as I said earlier, that illness was thought to be something that we have to focus on getting it better. But we did not pay too much attention to diet and nutrition. As we are going ahead, we are realizing that even a few hours of starvation actually has a counter effect on the body. Previously used to starve people for days after surgery. And we started realizing that actually doing that caused more complications than less. And then we started realizing that, hang on, we really need to keep the gut flora very, very active and intact. So early feeding, not starving people too long, giving you the right diet after surgery, giving you the right diet for recovery, all is becoming mainstay of modern medicine. So as I said, you asked me a very, very big question right at the beginning. But diet is now all encompassing. And this goes very much with the way Hindu tradition says that actually you are what you eat,
Right.
right? So we say that we have diets which will affect you. You have different types of tamsi diet and sattvic ahar. That is all very real because now we understand the science.
Yes. Yes, sir, that was really meaningful insight. And as you mentioned about the Ayurvedic form of diet, which the scriptures, ancient scriptures, teaches us that should be incorporated into the world, that is really needed for now. And definitely, when you consult a dietitian, I feel that majority of your questions are resolved by communicating with the dietitian. That is the main part of consultation. So, moving ahead, my second question to you is how can technology help predict potential health issues related to nutrition, such as deficiencies or chronic issues?
So again, it's a very interesting question. If you ask me whether we are using nutritional assessment as a tool effectively today, the answer is we don't yet. And that's because traditional thinking didn't allow us to think beyond. So, for instance, if you look puffy, then I used to know, okay, she probably has a heart disease. Or if you look breathless, I would say, oh, she's mildly asthmatic. But what it is doing to your nutrition, your well being, was not very well assessed. Now, as we go forward, it is becoming pretty obvious that we can actually use nutritional assessment as a tool to decide not only what the disease is or how severe the disease is, but how we should potentially manipulate it. Now, what you will be surprised is, and I'll give you a very simple example where this turnaround came. We used to give antibiotics in a lot of conditions like burns or pancreatitis, and this was only 40 years ago. So, if you look at literature from 40 years ago, one of the mainstay of treatment of a lot of these very, very life threatening diseases used to be antibiotics. There was not even a mention of anything to do with diet. Then, about 30 years ago, people started realizing that if we give people probiotics, that actually is far better than antibiotics. And people studied a lot about it and started realizing that actually maintaining the gut flora and maintaining your nutrition is really, really important for recovery. Right? Now, with regards to your specific question, are we using technology for assessing chronic conditions? The answer is not yet, but we are all now starting to realize the importance. So, when you do your assessment, for instance, in UK, we use a tool called Must, right? And that is a more, it's a tool for nutritional assessment. It's kind of now becoming the mainstay of most of our assessments of inpatients. When you are admitting someone, you might not necessarily maintain their nutrition until unless you already monitor it. Merely giving someone food twice a day is not nutritional maintenance. You really need to start assessing things beyond that. Or for that matter, when you do someone's school assessment for even a minor condition like asthma, you actually have to check what their overall health is. So, nutritional assessment is going beyond height and weight. It is now going to a much deeper assessment, and this is where technology will play a role. I'll give you a very interesting device I had seen a few years ago. It was called Vitastix. It came from one of the Eastern European countries. It allowed you to do assessment of minerals and vitamins in non-invasive fashion. I never knew the validity and the clinical accuracy of the device. But the thought was right. That they claimed that they actually could assess your nutritional status non-invasively, but for micronutrients, not for your macronutrients. So over a period of time, we'll understand the importance of all of these micronutrients, and that will be a huge tool in our disease management, so say.